Hello friends, I'm Dr. Rajeev Sivasankar. I'm the Director of Neurovascular Intervention at Fortis Hospital, Mulund. Many a times we are faced with this question as doctors. Doctor, do we put stents in the brain also, like we put in the heart? And the answer to that question is yes. We do on many occasions utilize stents in the brain. And why do we use these stents? Just like cardiologists use stents in the heart to reopen blocked vessels, similarly, neurointerventionists use stents in multiple conditions. Now, what are these conditions? Now, before that, let's see what stents are. Stents are nothing but metal tubes. These are tubes which are designed to be used inside blood vessels, and they are utilized for a variety of reasons. One of these is to reopen vessels which are very narrow, which is called stenosis, or it can be also used in some situations wherein we need that metal tube to give us support for another procedure. For example, there may be a ballooned part or segment of the vessel called an aneurysm, where you require a stent to provide support so that certain material called coils can be put within that aneurysm. So stents now can be used to provide the support or scaffold in order to treat these aneurysms, which is a procedure called stent-assisted coiling. The third situation where we use stents is in an emergency where the patients come in with acute strokes, which is a life-threatening situation wherein they have paralysis or they can lose consciousness, etc. In these situations, there is a blockage of the vessel, which is critical, which doesn't reopen by only inflating a balloon, a procedure called angioplasty, in which case, in an acute setting, neurointerventionists are constrained to reopen these vessels by using a stent in an acute emergent situation, a process called acute stenting. So these are a few of the examples where doctors use stents in the brain. It is also pertinent to note that a situation called ICAD, that is intracranial atherosclerotic disease, a condition where there is blockage of the brain vessels akin to blockage of the vessels in the heart, is very common in South Asia and in India, which is why just like we get blockages in the heart which cause heart attacks, is that we have blockages in the brain vessels which can cause strokes or paralysis or loss of speech, etc., which is again an indication where we may be called upon to use a stent in case medical management fails or is not very successful.